Welcome back to Taking Charge of My Cancer podcast, episode 60. Join me today is one of my great coworkers, Sammy Miller. She is a pelvic oncology physical therapist here at UF Health. She moved down to Florida after graduation from Misericordia University, where she earned both her a bachelor's in business management with a specialization in healthcare management and her doctorate of physical therapy. Original from Pennsylvania, she participated in competitive cheerleading through her childhood. This led her to cheer in college, where she served as a captain for 2 years. Her team played second against D1, D2, and D3 schools and nationals. And eventually, she became an assistant coach to the Misericordia's team. Sammy even spent a summer traveling across the United States teaching cheerleading camps. She enjoys spending time outside of work, going to Walt Disney World, running and traveling. And Sammy, has been really fun to have you with us in our team. So thank you for doing this, and thank you for being part of our oncology team.
Yes, thank you. It's really good to be a part of a team that is so supportive and really encouraging to both patients and each other.
Awesome. So you want to tell us a little bit about how did you end up doing pelvic health and why oncology?
Great question. I started wanting to be a physical therapist when I was pretty young. I was probably about 8 and I broke my ankle while cheerleading. And I eventually developed a condition at the time we called reflex sympathetic dystrophy, which is now known as chronic regional pain syndrome. So I did a lot of physical therapy when I was younger because I had like a chronic pain problem. And, the doctors weren't really listening. They were just sending me to PT, and the PTs are the ones who figured it out. But I always wanted to help people. It's always been something I'm interested in. And, in my young view, I always thought that Florida is where all the older people were. So I always wanted to be a physical therapist in Florida. So now I realize that's not how it is. Florida is very diverse and it's an amazing population to work for and with. But I decided during school, I did my research on endometriosis and, the roles that pelvic health physical therapy can kind of play in helping treat people with endometriosis. And so that led me to get interested in pelvic health physical therapy. My first job was here in Gainesville, and they actually had somebody who was doing pelvic health, so they didn't really need another person doing it. But that practitioner, Chrisley Blair, who is fantastic, she basically mentored me a lot about pelvic health physical therapy as she was going to be moving, and I was going to be taking over that role. I eventually took more CEU courses to get into pelvic floor physical therapy specifically. And I ended up being a patient in pelvic floor physical therapy. And I was like, wow, this really can treat so much and it can really change your life. So it's the person who was treating me was like, hey, we have a position open here at UF Health if you're interested. And I was like, absolutely, because this is a place that, really loves research and science and really is on the cutting edge of physical therapy and truthfully oncology as well, which at the time I had no idea about. But it has been such a pleasure to continue to learn from everybody and continue to grow. So yeah, oncology physical therapy is where I'm at right now. I've been taking even more courses on oncology and physical therapy and pelvic health, which has been just super delightful.
Awesome. So if you want to explain a little bit to the audience, like, why will be your role? Like, for instance, let's have, pretty straightforward, we know gynecological cancer. So if you come across somebody with cervix cancer or uterus cancer, like what will be your role? Like if you want to explain a little bit in
Sure.
words, like what will be your role to treat these patients?
So great question. There's a lot that patients who are going through gynecological cancer need, right? So you have patients who are going through chemotherapy treatments, who are going through radiation and chemo and brachytherapy all together. And so all of those play a big role in changing how our body works. So a lot of the times, and I think you can probably echo this, Durley, like when you're treating patients who are going through chemotherapy, they have a lot of cancer-related fatigue and a lot of changes on how they're feeling, right? And it's important with all of these patients, to keep them moving and keep them exercising, because exercise, I think there's a lot of research that supports exercise helps to vascularize the tumor, especially with chemotherapy, to get more chemotherapy to the tumors itself. And so that's important. It's important to educate them on lymphedema, and try to help sort of prevent it as much as you can. Know the signs and symptoms of lymphedema and educate the patient so that if they ever start experiencing this, it's something that they have a jump on right away. In its early stages, it is reversible, but in its later stages, it's not reversible. So it's important to teach those with gynecological cancer to, see those early and catch the signs early so that they're not too far behind when they go for treatment. My other roles is teaching patients how to do, external and internal manual work as well. There's a lot of risks with radiation therapy. There's radiation fibrosis that can happen. And what that is basically, when the cells grow back after radiation, they come back almost scar-like. So it puts you at a risk for vaginal stenosis, which would lead to future problems with getting pelvic exams down the line. And it could also lead to problems with intercourse, which is an important activity of daily living for most people. So my role is trying to help kind of look at all of that stuff, educate the patient, teach the patient, treat the patient, as well as any other deficits they're feeling. A lot of times people will have urinary changes, urinary frequency, urinary urgency, or loose stools or bowel movements that are more constipated when they're going through radiation. So it's important to teach them different managements for all of those things.
That's amazing. You know how many people, unfortunately, pelvic health is something like, people is just don't talk more about it, right? So yes, I'm going through a cancer treatment, and I just feel kind of almost embarrassed to talk about how important sexuality is for them. So they feel like, well, I shouldn't be thinking about that if I'm going through these cancer treatments, right? I'm kind of fighting for my life, but then what will people think if I start thinking, what about intercourse? What about my sexual activity, right?
Right.
So it is such a taboo talking about this that people doesn't know that, right? So they just feel like, well, I guess my cancer treatments, meaning I have to be thankful because, doctors are helping me to save my life.
Mhm.
I'm just going to have to get stuck with these effects because it's just what it is. And it is not, right? So I just don't know how many patients I come across what we just talk about how is you're sleeping, right? For cancer fatigue management. And they say, well, I'm not really sleeping well because I have to get up to the bathroom 3, 4 times during the night. And that's when I start talking about the important role for a pelvic health therapist. And they're like, oh my God, I have no idea. And then, when they go and see you guys, it's like, oh, thank you so much. That really make a big difference in how I feel. So it's such an important part of your body that we tend to neglect it because it's just society tell us it's okay to wear pads. It's
Mhm.
okay to just have this and that. It's okay to just don't have that active sexual activity just because, just worry about more your other treatments and then worry about that, you're alive. So,
Mhm.
but all that is part of your quality of life that is important. So, glad that you guys are really seeing patients again and can be just not during cancer or cancer survivors, but even down the road, right?
Yes.
You actually has been, we had a conversation about the important role with pelvic health and breast cancer patients. You want to tell us a little bit more about that?
Yes, absolutely. So one thing with a lot of breast cancer patients is they're put into menopause, right, with their treatments. And so that could be very early menopause for some of these patients. But the changes in your body when you're going through menopause are really can be quite detrimental, right? We live our whole life. I know me as a woman, I was always looking up to my mom, my grandma, my great grandmothers, about their quality of life. And they're like, this is just how it is to be a woman. Your body will change. You will have urinary leakage. You will have no libido. You will have, all of these things. This is just how your life will be. And that's not the case anymore. There's a lot of different treatment options, especially with the changes with our breast cancer population. Now that they're a cancer survivor, right? Now that they've survived and they've gone through all this treatment, their body is different. So you're missing that estrogen, and estrogen plays a big role in our body. It plumps up our tissues. It keeps your urethra closed. Okay. If you're not having enough estrogen, your urethra kind of opens up a little bit and you're more susceptible to UTIs. You're more likely to have urinary incontinence. Um, and that's a huge issue. But the other difference is we're not keeping our vaginal wall, our vaginal canal moist and plump either. Right. And so that leads to issues with intercourse. Now there's a lot of options on treating that. It's not just like, oh, I'm going to have painful dry sex for the rest of my life. It's not like that. There are vaginal moisturizers, there's lubrication. Some cancer oncology doctors are now they're leading towards estradiol is okay topically, but there's still a lot of research to be done in that area. But there are people in different parts of the country who are getting estradiol topically to help with their symptoms. But again, that's still up in the air. I can't say for sure that it's the right thing to do versus not the right thing to do. So I mean, if you're having that issue, after cancer treatment, a lot of times I have patients that are like, there's nothing you can do because my estrogen is different. And it's like, there are plenty of other things that you can do. Like, I had a patient who was very young, probably early 30s, that was like, the rest of my life, I'm just not going to have sex anymore because it's painful. Right. And so could it be painful because of the dryness? Yes, but it could also be painful because you had a painful experience because of the dryness. Now the muscles have changed in the pelvic floor. And now they're angry and they're tight and they're not going to allow you to have intercourse like you did before. And so maybe you need treatment to get those muscles to kind of relax and calm down, so to speak.
Mhm.
So, yeah.
That's amazing information. What type of resources would you recommend to patients that are going through this?
So there's a lot of great podcasts out there as far as like talking about pelvic health, physical therapy. Surprisingly, there's tons of podcasts. I will say I am not really a big book person when it comes to like reading, but I do like a good podcast here and there. So one good podcast is the Pelvic PT Rising, which is by like a really big leader in pelvic health physical therapy, Nicole Kozian. Another good one is PT below the waist. Again, this is a really good one for patients specifically. And then the last one is the Penis Project. And that one really talks a lot about prostate cancer, pre-op, post-op. So those are like a good 3 podcasts that I would totally recommend.
So you mentioned prostate cancer. So let's touch on that a little bit. So um, what is the role as a physical therapist in pelvic health with patients who are being diagnosed with prostate cancer?
So again, it's not too different from, gynecological cancers, but we still have the same pelvic floor muscles between male and female, and they can still have the same issues with radiation and chemotherapy and lymphedema. But the other big thing is a lot of times I'm seeing a lot of patients pre-op and post-op for prostatectomy. And so the difference is that females, we don't have a prostate, but males do. And the prostate plays a big role in preventing urinary leakage with males. So once that is removed, they have to use muscles that they've never used in their life to hold in their urine. So it's all about teaching them how to do those pelvic floor muscle contractions and to kind of get those muscles to activate, so that they're not having any urinary incontinence and they don't have to rely on pads for the rest of their lives. So that's a huge, huge thing with our prostatectomy patients. The other thing is, again, the importance of their sexual function as well. I think there's really great books. I think it's like Male Cancer Sex, I think is what the name of the book is. And then there's Female Cancer Sex, and they both kind of talk about, the changes that you go through with cancer and cancer treatment and cancer surviving, and how can you kind of face that and overcome it, right? The prostate has all of the nerves to help with erection. So even if you have nerve-sparing prostatectomy, there's no guarantee that you'll ever have an erection again. So there's lots of options for males who are having difficulty with erections. So that's the good thing for them. There is like 6 to 10 different things that they can try, medication every day, medication as needed, injections. They have penis pumps. Um, they have like inflatable devices that go inside your penis to help you have an erection. So there's tons of options, but it's also educating those people on the risks of those options as well. So, I mean, there's a huge role. Same thing, prostate cancer, same thing, radiation, chemo, all that stuff.
Right. And again, for people who is listening this wonderful information, it's just not just the pump, right? It's not just the medication. It is the combination with that and your pelvic floor training and strength and all these other things that play such a big role, right? I
Yes.
think that with that goes along, all your mental health, or how many times you have in trouble because mentally, it's like you're afraid not to respond, right? As
Mhm.
high to those needs from a woman or your wife or your partner or whoever you're with. So it's just kind of really taking in consideration that it's not just piece of the puzzle, but everything takes place. Your mental health, your nutrition, your activity, how strong those pelvic floor muscles are, the correlation with that, and your core, the correlation with that, and fascia, flexibility from core down to the hips. So everything just correlates so much that is really important for our listeners to know. It's huge the role of physical therapy in this situation, how much we can help to connect all those little pieces of that puzzle to kind of try to get you as success as possible. So, great.
Yeah.
Can you give us 3 valuable tips that you learned about your journey, not just like with you, but as well for cancer patients? Okay.
Um, a little bit of both. I think that one good one is to keep your body moving, right? We see these patients all day long. We see them in different stages of their life, different stages of movement during their life. But I can see like the people who keep active, even if you're just walking a couple days a week, I feel like it's so much faster of a recovery with anything that's going on in your life if you keep your body moving. There's so many benefits to exercise. It's really easy to say like, oh, well, I'm too busy or I don't have time. But if you put in the time now to have a healthy, active lifestyle, you're not going to regret it in the future. Right. I think that was a huge thing for me going through, graduate school. I worked 3 jobs at the same time. I was super busy. I was really not active physically, and it was wearing on me mentally. And after graduation, I started being super active, and I just my whole lifestyle was like just more energy, more happiness. Um, so I think that's a huge thing going forward, as I would recommend to everybody to just move your body in whatever way makes sense and feels good to you, right? That's my one tip. Let's see, 2 other tips. I would say one other one that's really good, I think specifically with cancer patients, is to learn a little bit of mindfulness or meditation. And again, it doesn't have to be spiritually linked. It can be linked to whatever you'd like it to be linked to. But finding that there's really great research out there that supports meditation, yoga, mindfulness in any capacity. Getting out in nature. I think we talked about this yesterday, Durley. There's like a really great little garden right next to where we work, and I've totally not even utilized it as I should. But meditation is super, super great, specifically for cancer patients, but everybody as well. I mean, it's very important to take a look at your mindset and not judge your thoughts and your feelings and just acknowledge them and do with what you need to do with those, which sounds a little crazy, but it works. It works well.
Excellent. How about the most painful lesson that you learned through this?
Wow. My most painful lesson was probably that you can't be your best all the time, that's really hard when, you want to be the best at what you do all the time, right? Most people strive for that perfection or that amazing. And, I can't, I was very hard on myself when I first started, especially pelvic and pelvic oncology, to try to give everybody all the info on day one, right? And I'm like, oh man, I didn't tell them about this, or I didn't tell them about this. Usually I'll have those patients come back, right? And I'll be able to tell them about that later. But I was like so defeated every time I'd be like, oh, I didn't get to that in this time period. It's like in 45 minutes for me to get a whole story and to get to know you and get to have you trust me and me trust you with, this very personal information. I can't be my best and I can't give you everything always on day one. And so that was really hard for me because I'm very like, I need to be this person's champion going forward. So that was really, really tough. It was a tough one for me.
Okay, I can totally see that. But you don't know how much, even with a little bit of information that you give, even if you only have so much time, how thankful the patients are for that. How much are you really helping them? How much you open their eyes? How much information you can just kind of really tell them so they can go and hopefully look for, more info to get them where they need to go to get help for whatever need they have. So that's usually, it's a good eye opener.
Yes.
Is there anything that you have that will be of value for our audience, and will you share that with us?
Ooh, great one. So through the pelvic physical therapy lens, I think something that is super valuable knowledge to know is that it's not normal to have any urinary leakage at all. Even as a woman, not normal. You should go talk to your doctor, talk to them, ask them to go to pelvic health PT, or ask them if they have any advice for you. Because it's super, again, we are raised in the society that we're like, oh, well, if I have children, I'm going to have urinary leakage. That's just going to be what my life is. That is not normal. It is very common, but it is not normal. Same thing with pain with intercourse or pain with pelvic examination. Please, please seek out some, healthcare advice on what to do. Of course, I'm going to champion for pelvic health PT. I think that it's super important. But please, if you're having any of those symptoms, go talk to your doctor about it. Go ask about pelvic health physical therapy. I have patients all the time when I ask them the question of like, do you have pain with this? They're like, yes, just the normal pain. I said, not normal. Not normal. So making sure that you're really taking care of your body. I mean, that's something super valuable to get out there, I think.
Yeah, and that's a great point. And it's not only if you're just having kids or you are a little bit younger, but even though, and that even happened to me personally, I have a situation where I had a really, really bad cough from just a cold. And that was that kind of like cough, cough, cough that started to have some leaking. And I'm like, holy cow, I need to go see a pelvic health therapist, make sure, because I have kids, and I was like, let's make sure that if I start having these symptoms, I'm taking care of it right away. So I went and saw, and that was a nurse practitioner. And the first thing she says, like, well, and I think I was back then, maybe my 40s. And then it's like, well, as you know, we're getting older, so expected to start kind of like, have a good pad. And I was like, what you just said to me? And then I'm like, that was it. That was the last time I went to see her ever. And I'm like, we're changing, I'm changing to a different gynecologist. And I gave her a lecture about how wrong she was about
Yeah.
advising somebody that this is natural. It is not natural. And yes, a cough to me. And then, yes, I did a little course of pelvic therapy
Mhm.
with one of my colleagues, and that wasn't anything major, but she got me some stuff that, I'm good. And that wasn't really even a couple of sessions, but that was great info. But I was just kind of like, are you serious? A healthcare practitioner is telling patients, woman, that if you start getting, after 40s, it's okay for you to have some leaking, and it's okay. And it's just start looking into what kind of pads are you going to use. I
Yeah.
was like perplexed by it. I was like, again, I gave her a whole lecture about what physical therapy can do and how wrong was assuming that. Because then imagine even the 80-year-old, I tell my mom is 80 years old. And
Mhm.
then locally she's great and she has no issues. But I always say to her, if you get to a point that you're cough and you start leaking, it's not normal. It has nothing to do with your age,
Nope.
So not because you are older means that you just have to deal with it. Because
Right.
it might happen when you start using pads, that's going to lead more into urinary tract infections. And this is the number one thing that gets you with mental changes. When you're older, all those kind of things start to release, a whole change develop. So
Yeah.
yeah, absolutely. Great thing that you touch on that. So age has nothing to do with it. So
Speech has nothing to do with it, and your doctor should also never tell you, because this is an experience that I had, is just if you just have a glass of wine and just relax before trying to have sex, it won't be painful. And I'm like, that's not how it works. I was not a pelvic health PT at the time, so I couldn't be like, listen, that is not the right advice here, sir.
oh yeah.
I remember thinking like, is that really my only option? You know, so there's still
Yeah.
practitioners out there that kind of don't know what we do, but always trying to educate people to try to really advocate for themselves and get the help that they need.
Yeah, exactly. And again, I'm sure that a lot of my colleagues and even PTA students listen to this podcast. So again, it's our role to continue educating other healthcare professionals about what we do and how much they can advise patients so they don't have to advise a glass of wine type
Yeah.
of situation. How can people find you?
So you can find me at UF Health here in Gainesville. I treat at two different locations, at the Magnolia Park location and Medical Plaza. You can also find me on the internet. I have a social media that's it's a personal account, but I am very open about what I do and how I live my life, because this is just my life and I get to have fun with it. So my Instagram handle is McThick, so MKTHYK. I have a very common name, Sammy Miller. I had to be creative in some way, so McThick is my handle on Instagram.
Yeah, and I will
So
put I put it on the show notes. So
perfect.
I put all that information in there. And then you talk about podcasts already. Any movies that you would recommend?
Hmm, that is a good question. I am a classic movie person. I don't personally do a lot, but my favorite movies are more like rom-coms and comedies. So I would always recommend everybody to watch Clueless. It is just so cute and adorable, an adorable chick flick. 10 out of 10 recommend.
Okay, good. That's good to know. That's very good to know. It is one question that you wish I will have asked you, and you have answered to wrap up.
Good question. I think a good question to ask me personally, maybe, hmm, could be like, do you have like a favorite population to treat?
Yeah.
And honestly, I don't. I treat everybody over the age of 18. So anybody over that age for
Uh-huh.
me is my favorite. I just love being able to educate people in general about all of this stuff, because again, it's so taboo. We don't talk about it enough. It's not like a, safe area to talk for a lot of patients. Especially being in Florida, it's really, really difficult treating patients who are trying to transition or are transitioning or are part of the LGBTQIA plus community. It's really important to, treat everybody with the respect that they deserve and get them the healthcare that they need. So I like treating patients. I just super enjoy my job so much.
Awesome. Yes, I know you do. Actually, I have one last question, which I was
Okay.
really surprised. So you mentioned as in your childhood, you have RSD.
Yeah.
I'm like, wow. So
Hmm.
again, I don't know tons about it, but so for the audience, this like, sympathetic autonomic reflex, right? That's how it is.
Reflexive sympathetic dystrophy, something like
Yeah,
that.
yeah, exactly,
Yes.
something like that. And then so in my whole career, I've been coming across some patients, which is really difficult to treat.
Mhm.
So I'm like really like, how did you overcome that? Because I mean, at least you have issues and you never mention it.
Yeah, no, I haven't had any issues for a while. So I broke my ankle when I was like 8 at a cheerleading competition, and I was put in a boot and told not to put any weight on it at all, and I did not for quite a long time. And once I started trying to walk on it again, it was like so painful. It was still having some swelling. My skin was like hot and thin. It had a lot of redness to it. It was shiny. I mean, I went to like 3 different orthopedic doctors and none of them listened. They just looked at my mom and was like, yeah, she's making this up. Like, she's fine. And I was like, I'm not fine. I'm very not okay. And so that was really hard. I saw a pediatric neurologist for a while. I was on gabapentin for many years. I was taking it every day for years. And then they finally were able to kind of wean it off because I'd been doing everything that I wanted to do. I'd been back to cheerleading and all that, but it was really that non-weight bearing that's like a big part of the problem. And it's, in females of that like younger age category, it's more common as well. Just in fractures of your ankle or on your wrist. So getting that weight bearing, I think, was a huge part in the recovery for me, but it was pretty crazy. It was a crazy like 2 years of like me wearing a boot almost year round for 2 years.
Wow. Wow.
Um,
They didn't offer aquatic therapy or anything like that back then?
No, so no, not at all. They put me, I think my PT, my second like round, once they kind of figured out what was going on, they put my foot in an ice bath for like 10 minutes before the session. And so they would make me move my foot like in the cold water, but that was pretty much it. And then there was a lot of balance training and weight training and foot intrinsics that I can look back on now and kind of really appreciate that they got me pretty far. Like I was not able to walk, and then I was back to cheerleading full time competitively. So
Wow. And you're now running marathons. You just run a marathon, the Disney Marathon. So
yeah,
that's amazing. That's really nice to see the story that way because I have the patients I came across, they were as an adult and I just, like I move on from the place I was working at. So I just don't know what happened, but I thought that was like a lifetime, never
yeah,
will be better situation. So
yeah, absolutely. And I think I don't know what the textbooks really say about like how long or what the prognosis is like, but I mean, I'm not sure if my body was just more resilient as a young child and I was able to overcome it in that way and kind of let the nerves heal and kind of
mhm.
redo themselves. I don't know. I don't know what
Oh,
happened, but
glad you're over. Well,
yep.
Sammy, it has been a pleasure having you with me this afternoon. Thank you again for being part of this podcast.
Yes, thank you. It was a pleasure.
All right, have a great afternoon.
Thank you. You too.
Bye.